Imagine waking up one morning, feeling more exhausted than ever, struggling to catch your breath, and noticing unusual bruises on your skin. It's tempting to brush these off as symptoms of stress, but what if they're signals of something more serious? Leukemia is a type of cancer that affects thousands of adults each year, often showing up with symptoms that are easy to ignore until it's too late. But understanding this disease can make all the difference. What is leukemia? Leukemia is a type of cancer that starts in the bone marrow, the body's blood cell factory. But instead of producing healthy cells, it goes haywire, creating abnormal, immature blood cells that don't function as they should. These cells crowd out the healthy ones, leading to all sorts of problems. So, what does this mean for you? Let's break it down in the simplest way possible. Blood cells, the unsung heroes. Your blood is full of different cells with specific roles. Think of white blood cells as your body's defenders, red blood cells as the oxygen carriers, and platelets as the little repairmen who help with clotting. When leukemia hits, one type of white blood cell begins to grow uncontrollably, taking over the bone marrow and pushing out the healthy cells. And that's where the trouble begins. Types of leukemia common in adults. In adults, leukemia doesn't look the same for everyone. There are 4 main types, and each one grows and spreads differently. 1. Chronic lymphocytic leukemia, CLL. CLL is the most common form of leukemia in adults. It affects lymphoid cells that become lymphocytes, a type of white blood cell. CLL often creeps in slowly, sometimes so subtly that people don't even notice symptoms for years. Over time, it can spread to other parts of the body, including the liver, spleen, and lymph nodes. 2. Acute myeloid leukemia, AML. AML grows rapidly and affects myeloid cells, which would normally develop into red blood cells, white blood cells, and platelets. Unlike CLL, AML can make people feel sick very quickly. Common symptoms include fatigue, fever, and easy bruising. 3. Chronic myeloid leukemia, CML. Similar to AML, CML also affects myeloid cells. But unlike AML, CML progresses slowly. Many people are diagnosed with CML in their 60s, and while it's a serious condition, it can often be managed for years. 4. Acute lymphoblastic leukemia, ALL. Though more common in children, ALL also affects adults, accounting for around 20% of adult leukemia cases. ALL grows quickly and requires prompt treatment. Without swift action, it can spread beyond the bone marrow, affecting organs throughout the body. Symptoms to watch out for. Leukemia symptoms can be tricky to pinpoint because they are easy to dismiss as something else. Here's what to watch for. Anemia. You might feel constantly fatigued, weak, or short of breath because your body isn't making enough red blood cells. Frequent infections. Leukemia compromises your immune system, which means you might catch infections more easily, or they might last longer than usual. Bruising and bleeding. If you're finding bruises you can't explain, or you're bleeding more easily than normal, it could be due to a shortage of platelets, the cells that help your blood clot. Some people have more subtle symptoms, such as night sweats, swollen lymph nodes, or even joint pain. These can all be signs that something's wrong with your blood cells. What increases the risk? Certain factors can increase the risk of developing leukemia. 1. Age. Most types of leukemia are more common in adults, especially as you get older. 2. Genetics. If someone in your family has had leukemia, your risk might be slightly higher. 3. Previous cancer treatments. People who've undergone chemotherapy or radiation have an increased risk. 4. Exposure to harmful chemicals. Benzene, found in gasoline and cigarette smoke, is a known leukemia risk. 5. Certain health conditions. People with certain genetic disorders, such as Down syndrome, may also face a higher risk. Diagnosing leukemia. The diagnosis process is thorough. Doctors will start by asking you about your symptoms and performing a physical exam. Next, they'll recommend specific tests, such as complete blood count, CBC. This is a blood test that counts the different types of cells in your blood. Bone marrow biopsy. In this procedure, doctors take a small sample of bone marrow to examine it for abnormal cells. Flow cytometry. This test analyzes the types of cells in your blood and bone marrow, providing valuable information about the leukemia. If leukemia cells are found, doctors will look to see what kind they are, myeloid or lymphoid cells, and determine how advanced the disease is. This will help them decide the best treatment. Treatment options for leukemia. Treatment depends on the type of leukemia, how fast it's progressing, and other factors, like your age and overall health. 1. For CLL, sometimes, CLL doesn't require immediate treatment. Patients may be monitored with a watch-and-wait approach. If treatment is needed, doctors might use targeted therapies or chemotherapy. 2. For AML, AML usually requires aggressive treatment right away. Chemotherapy is the main treatment, but some cases may also involve targeted therapy or a stem cell transplant. 3. For CML, tyrosine kinase inhibitors, TKIs, have revolutionized CML treatment. These targeted drugs work by blocking the protein that leukemia cells need to grow, helping many people control the disease with fewer side effects. 4. For all, due to its fast growth, all requires immediate treatment, often involving a combination of chemotherapy, targeted therapy, and possibly a stem cell transplant. A stem cell transplant is like hitting the reset button for your bone marrow. It replaces damaged cells with healthy ones from a donor, giving the body a fresh start. However, it's only recommended in specific cases and after careful evaluation. When to seek help. If you've been experiencing unexplained symptoms like fatigue, infections, or bruising, don't ignore them. Leukemia is serious, but early detection and treatment make a big difference. A healthcare professional can help determine if what you're experiencing could be a sign of leukemia or something else. Final thoughts? Understanding leukemia doesn't just mean knowing the facts, it's about recognizing the symptoms, understanding your risk, and knowing when to seek help. This knowledge can make a world of difference, whether for you or for someone you care about. Remember, your body often gives you clues about what's happening inside. Listening to it could be your first step toward finding answers and getting the help you need. Thank you for joining us on this journey through understanding leukemia in adults. Please subscribe for more in-depth health content that helps you stay informed and empowered.